the sections relating to social protection. First of all, I want to congratulate the staff in the Department of Social Protection for the tremendous work they have been doing for the past fortnight under immense pressure. While I welcome the move by the Government to make special provision for people who are in receipt of illness benefit as a result of contracting the disease or self-isolating or isolating on medical advice. Nevertheless, I am not entirely happy with the approach taken by the Government in this legislation, because the legislation does not change anything. It does not effectively change the rules on social welfare. What it does is it gives the Government power to bring in regulations at some unforeseeable time in the future to change those rules in a way which we are not, on which we are not entirely clear. And I think it's quite frankly, it's a bit surreal to be having this debate in the absence of those regulations, because there's a great deal of confusion out there, as the Minister will appreciate. And, the approach adopted by the Government doesn't do much to allay that confusion. I'll give you a few examples. In Section 5, subsection 10, the Government gives us the power to apply minimum contribution conditions for illness benefit. The Minister tells us today that that will effectively mean one paid contribution. It was just have been as easy to say that on the face of the legislation. In Section 5, subsection 11, the Government gives us the power to vary the rate. We are told it's going to be increased by 50%, the basic rate, up to €305 per week. It would be appropriate and it would be better that should be stated on the face of the legislation. We are also told that the Government intends to waive the requirement of waiting 3 days for job seekers' allowance or job seekers' benefit in the case of people who are laid off because of the crisis. Again, it would be quite possible to state this on the face of the legislation, and frankly I can't understand why that's not being done. I want to ask the Minister a number of questions. First of all, the Government in their announcement said they are going to raise the basic rate for people who are in receipt of illness benefit as a result of contracting this disease from €203 at present to €305 per week. Now, as the Minister will be aware, people in receipt of illness benefit, in many cases they have dependents, and they get a proportionate increase for the adult dependent and then a fixed amount for child dependents. Is it the Government's intention to just increase the basic rate, or will there be proportionate increases for dependents? Secondly, I think the intention is that in the case of people who self-isolate, the intention is that they will be paid the increased benefit for a period of 6 weeks, but that's not clear in the legislation, and I'd like to query that. There's a number of other issues which arise and which people have brought to my attention. For example, somebody who's laid off as a result of this crisis, and there's 140,000 people in that category as we speak. Many of their employers want to top up their social welfare payment. Now, the Government have decided that they can pay the full payment and claim back €203 per week. Many small employers are not in a position to do that. So I want to ask the Minister, is it possible for an employer to top up the amount of social welfare by €50 or €100 a week, or whatever they can afford, and will that have future consequences, particularly for people in receipt of job seekers' benefit? I also want to ask the Minister, what is the position of people who are already in receipt of a social welfare payment, such as family income supplement, widow's pension, working family payment, for example? I want to ask the Minister, is he aware that many healthcare workers, and God knows we need every one of them that we can get our hands on, many of them have approached me and they've said that they will have to stay at home to mind their kids while the creches are closed, because they have to pay a retention fee to the creche and they simply cannot afford the cost of bringing in a childminder. Now, has the Government some proposals on that? I also want to know the situation as regards people who contract the virus while they are abroad. What arrangements are going to be made to pay them? I also want to ask the Government, in relation to old age pensioners, there is a suggestion that pensioners should be paid possibly 3 or 4 times their pension in one lump sum, which would enable them to not to have to visit the post office or have a nominated deputy, which many people are unhappy with, visit the post office. I also want to ask the Minister, the sum mentioned for the social welfare changes is €2.5 billion. Now, obviously that figure came from somewhere. So what sort of figures does the Government anticipate will contract the disease or have to self-isolate in order to justify the payment of that? In other words, how many people is that equivalent to? Now, I have many other questions. Just strictly on the non-social welfare side, I would ask the Minister to do something about the management companies of apartment blocks who are making no effort whatsoever to help their tenants keep the shared areas of those clean. And I would also ask the Minister to consider the position of charitable and community organisations whose fundraising activities are going to be wiped out, literally. Something should be done for them also. I have many other questions, but I'll defer to my colleague and we'll raise them on committee stage.
Thank you.